Hi survivors, it's me, Purpose, I'm reporting to you. Today is the last day, unfortunately, for healthcare workers in New York City, or I don't know if it's in the entire state, but I know in New York City, to get the ouch, or they can face losing their jobs. And this is really harsh, and we are living in very, very critical and trying times. And I just think, I'm not saying that people should or should not get it. I think people should do what's best for them and what they feel is best for them. But, you know, the country's divided right now. You have those who are for it and you have those who oppose it. I don't think that, this is my personal opinion, I don't think that it should be infringed on someone. But let's go ahead and let's read it. They were interviewing this young man who works in the healthcare profession, and he works in the hospital, and he said, they asked him why come he didn't want to get it or something like that. And he said, well, he just doesn't want to do that, and he can go and find a job. And they said, what if he faces losing his job? He said there's other jobs that he can go and get that he's been looking into that does not require that. So it's just really hard when you're telling people they can lose their jobs. That they can lose their jobs? That's really harsh, you know, when people have themselves to take care of, and this is my personal opinion, you guys, and their families to feed. So it goes on. I pull up an article about it, and this is what it says. It says, New York. Monday is the deadline for New York State healthcare workers and New York City school employees to receive their first dose of or face termination. The looming deadline is sparking outrage among many, including unions, as well as creating fears of a teacher shortage if not enough substitutes are available, if they don't have enough of the ouch substitutes that are available. Mayor Bill de Blasio and Governor Kathy Hochul both insisted Thursday that the mandates will be enforced. What's looming for Monday is completely avoidable. Right now, 84% of healthcare workers have received at least one of the ouch, and officials say they are confident that number will go up. Worker at New York Presbyterian faced a Wednesday deadline, and officials say 99% of the health system's 48,000 employees and affiliated physicians complied. Fewer than 250 did not. A lot of them that they just said probably complied because of that. They were facing losing their jobs. And that's so harsh to do someone like that. And like I said, and I have to continue to iterate, that's my personal opinion. It's just so anti-American, and it goes against our constitutional rights. Still, if a shortage happens, temporary workers from places like the Philippines and Ireland may step in. So maybe that goes to prove or show that's why they've allowed so many people from other countries and crossing these borders to come in to replace Americans' jobs, allegedly, and to get benefits that so many of us have put into the system that they haven't even put into this system, as far as our tax dollars, as far as all the time that we've worked these jobs and we put into the system, and all the time that we went out and spent our money on gas and food and all these things, that in ways that we put our money into the system, they allow other people from other parts of the world I'm not against people coming to America. I'm just saying America needs to take care of Americans first. That's how I feel, you know. So they're saying that these other people could just come and take these people's jobs just because they don't want to do something they're requiring for them to do. I think that's really cruel. Everyone I am talking to, I'm asking, do you have any healthcare workers? It is going to be a Department of State approval process we have to work through. So this will not help in the next couple of days. Another option is adjusting licensing requirements so that out-of-state workers can provide backup. The bottom line is, for everybody's sake, just take the, ouch, Bellevue hospital worker Tunji Sawami said, you're touching people out there in the open. Protect yourself. And I do understand that perspective about it, but there's other ways that you can protect yourselves and you can protect others. They're acting as if this is the only way, you know, and I have to be careful with that because I really don't know if it's the only way, you know, but I do know that a lot of us have avoided getting it and avoided spreading it among other people because we're taking care of our health. And when we're going out, we're putting on the mask and, you know, we're taking the vitamins, the vitamin D's, and, you know, we're eating healthy and taking care of our bodies. And some people like my aunt, she's just not going anywhere. Since the beginning of this pandemic, she doesn't go anywhere. She works from home. And she hasn't gotten the thing. And so, you know, there's other ways, you know. I think people should be able to have that choice. It says the mandate for New York City public schools will also take effect after a judge lifted a temporary restraining order in a lawsuit brought by city unions. Judge Lawrence Love sided with the city, finding municipal unions will be unable to establish a likelihood of ultimate success on the merits. The UFT estimates about 90% of its teachers have already received the thing, but the mayor says the city has a contingency plan. We have thousands and thousands who have already received it. We have thousands and thousands of experienced substitute teachers ready to go. He said, that's the obvious first go-to. But it's also true that central staff has thousands of certified educators who could step into roles. Anyway, you guys, it goes on and on, on and on, on and on. But basically the same thing. It's basically all the same thing. I don't know. You know, it's getting really hard out here to survive. That I do know. And it's imperative that we prep, we pray, we prep, and we plan. This is my perspective. This is what's been helping me. Been prepping for for a long time. Because if I say how many years, I probably give away my age here. You guys, for all of those who are opposed and you're facing deadlines at your jobs and you don't know what to do, I suggest you pray and I suggest you start working really hard. You know, starting your own business. I know it takes time, it takes money, but you can do it. You know, there's a lot of online jobs. I had to find online jobs because I have lost a lot of work because of it. So I did find some online work, and I know that you can do the same. Try to save as much money as you can or invest it wisely. I know I've been saying this on the last couple of videos, and I will continue to say it because these are the times that we're living in. Prep, prep, prep. I was so happy that I put away 3 to 4 years of food. I put that away in the last couple of years. So I've been able to go into my preps to prevent from spending money. I go into my preps and I use what I have. I'm so grateful to be a prepper. I have a lot of water stored up. I have bug out locations. I suggest you guys do the same. It's a security. It's a security that you have in knowing in these days and times when these things like this occur, that you have a backup plan. And food is getting harder by the day to come by. There's so many shortages. And if there's not shortages, the prices are overwhelming. I suggest you start a garden. You can grow a garden right in your house. You can, get some flower pots, right where you are. So that can be your security. So if they have a mandate, oh, you cannot go to the grocery store, allegedly. I said, if this happens, and for those who are opposed of that thing, you'll have some food already set in place. You won't be worried about this system. We're for the fight of our lives, you guys. And it's only going to get worse before it gets better. Prepare yourselves. Keep surviving. Watch the weather. Smell that water. Smell that water before you brush your teeth and you use it for your food. And if it has a foul odor, either boil it or use some backup water. Keep you plenty of water stored. Keep surviving. SandHair.com.